The FDA recently authorized and the CDC recently recommended a shortened duration at which someone can receive a booster dose for their Pfizer vaccine. So if you've had your first two doses of Pfizer COVID vaccine as a primary series, you can now get your booster dose as early as 5 months after that second dose. It doesn't mean you have to get it 5 months. You can get it after that period of time. But I think some of the data indicate that it would be better to get it closer to 5 months than the 6 month, as because we've seen over time there's been some waning of the immunity for all of the COVID vaccines. And therefore, their recommendation was that individuals, if they wanted a booster, could get it earlier rather than at 6 months. Well, I think it's important to understand there's not a single standard for cloth masks, right? There are some cloth masks that are very thin and porous, and some that are 2 layers or 3 layers, and some that incorporate high grade filters. So, collectively, referring to all cloth masks as a single standard, I think, is inaccurate and it can be misleading. Similarly, so when you talk about KN95 masks, unfortunately, we know there are a lot of counterfeit KN95 masks in the market. CDC, I think, had estimates of 60% or more of those that are on sale are actually counterfeit or false. So what you maybe think you're purchasing is a higher grade quality mask, it may actually not be. All that said, we've known since the beginning that there's a spectrum of protection as it relates to masks, and there were some early studies that looked at coronavirus and comparing masks, whether they were fabric or cloth masks, to surgical or medical grade masks, to KN95 masks, to N95 masks, and not surprisingly, those that have a higher level of filtration or higher level of certification seem to offer more protection. But I don't think that's any different for Omicron than it is for the previous variants. So it's important to also understand that masks are really just one part of our protection. And that masks in and of themselves really need to be properly worn no matter which one you're using. So masking, a properly worn mask in combination with vaccines and boosters, appropriate distancing, and hand hygiene are all those things that really in combination help reduce your risk of exposure as well as infection. So I think the data still show that the current vaccines are protective against serious illness and hospitalization, which is probably the most important function of a vaccine. We certainly have seen breakthrough infections with Omicron, just like we've seen breakthrough infections with Delta, as well as some of the earlier variants, because we know that none of the vaccines are 100% effective. That said, they still seem to be, for the most part, protecting those who are vaccinated at a higher percentage as compared to those who are unvaccinated, particularly if you have a booster. And they also still seem to protect against serious illness and hospitalization. Generally, not advisable to get more vaccination doses than are recommended, simply because the data for safety as well as efficacy aren't there yet. And so we're still waiting to see over time how much longer our immunity lasts with a booster dose. We've seen that with a primary series, say a 2-dose series of an mRNA vaccine, it does tend to fall over time. And that's why the recommendations came out for a booster dose, which enhances that immunity. But that could last several months or it could last longer. And so it's important to follow those data to understand, well, what would be the appropriate time to consider another dose? And then also make sure it's safe, because with most vaccines, you can usually get a dose after the recommended interval, but you never really want to get a dose before the recommended interval for safety reasons. Well, it's certainly possible we could need another booster. How soon, I think, depends on the progression of the pandemic, as well as I think the longevity of the immunity that is conferred from the vaccines. I do believe some countries like Israel have already recommended a fourth dose or a second booster, perhaps, for certain high risk individuals. I believe elderly individuals living in nursing homes and perhaps those who are severely immunocompromised. And so it may be that it's a phased approach similar to that you, for higher risk groups, you consider yet another booster. But I think it's also important to see over time how long the immunity lasts with the the current booster dose recommendation, and we still have a lot of people who haven't received those. So I think that's another important part. Well, the more data we get, I think, again, the more reassuring that it is that the safety profile grows for offering these COVID vaccines to younger children. Generally speaking, I think the safety data that we have been getting in has helped assure both the FDA that they could authorize doses for even younger children, which they've done recently. So, inflammation of the heart or the heart lining that they've seen in cases with individuals that have been vaccinated, those data have been, I think, fairly consistent over time that the rate of those occurrences don't outweigh the benefits that one gets from the vaccine itself, and that most of those cases are self-resolving, so they do go away. And I think that's one of the concerns that parents normally have. And I think it's important they discuss that with their pediatrician or their primary care physician for their children, because there may be some unique medical needs that they're concerned about that they need to have conversations about. Each one of those situations may be different. Overall, the safety profile is actually getting better because we have more data, and those data are actually indicating the frequency of those side effects are less over time as we get more patients vaccinated. I think first thing you have to keep in mind is there's not a single type of home test kit. And really, the important thing is no matter which one you use to follow the manufacturer's instructions. That's essentially how the test kit was designed. That's how it was tested. That's how it was authorized before it was released to the public. And so I think that's really something people need to keep in mind is that the most effective way to use a test is to follow the manufacturer's instructions. Deviating from that may potentially lead to false results, whether they're false positives or false negatives. And therefore, I think it's important to keep that in mind. I do think the testing companies need to continue to reevaluate their testing methodologies to make sure they're current. And we want to make sure that just like the vaccines are responding appropriately to the virus as it changes over time, we want to make sure that the tests that we're using also are continue to be accurate, both valid and reliable in terms of identifying coronavirus. No, if it's a PCR test, you can feel very comfortable that if it's a positive PCR for COVID-19, it's identifying specifically the SARS-CoV-2 virus. We also have PCR tests for influenza, however. In fact, we have tests that can evaluate whether you have COVID, COVID and flu, COVID, flu, and say respiratory syncytial virus, and even a full panel of other respiratory viruses. So there are very specific targets that those tests look for that allow clinicians to determine which virus you're actually infected with. I think first thing you need to recognize is the recommendations are really different for different populations. So some of the recommendations for the CDC for the general public are slightly different from the recommendations for healthcare workers, which are different recommendations for individuals, say, in correctional facilities. So I think it's important before you make a decision about testing to know which population you're referencing. But in general, for the general population, the guidelines were recently updated relative to both isolation and quarantine, as well as potential recommendations for testing. And for the most part, you really want to make sure that the test you get is accurate. And so sometimes if you get a test too soon, it may be negative because it was too early. Now, I think we're finding that's less the case with the Omicron virus because it does tend to infect very quickly. And that means that you probably see it earlier in the course of illness. Generally, the recommendations are that a test 5 days after your exposure or 5 days after your symptoms start is a pretty good time to get tested to see if you're actually positive for coronavirus. Unfortunately, that can be the case because testing is harder to access these days. Certainly, home test kits are very difficult to obtain. And if you go to a medical facility, there may be a lot of people trying to get tested as well. Certainly, the community testing sites are busy. But you don't necessarily have to get tested in the most situations unless that's a requirement. If you understand essentially what you can do. So if you're symptomatic and you think you might be COVID positive or might have been exposed to someone who is COVID positive, there are guidelines the CDC gives relative to what you should do around isolation and quarantine. And as I said earlier, they have made some adjustments to those periods of time. And so, what they're really outlining is that if you're exposed or if you're even positive, you really should be wearing a mask for 10 days just to prevent someone else becoming infected. You should be physically isolating depending on whether you're symptomatic or not. And so, those are things to keep in mind that it really depends on your situation of exposure or whether you actually have symptoms themselves. And unfortunately, we would like to have more tests available to make sure that you could use that as part of the protocol to release yourself from isolation or release yourself from quarantine. But if that may not be available, it should be important to wait at least 5 days in physical isolation if you're symptomatic, and longer if your symptoms continue. It's not advisable at all to go to an emergency room to get COVID testing at this time. They simply are overwhelmed with critically ill patients who need care, and many emergency departments aren't offering COVID testing anyway. And so it's better, even though there's challenges in getting them, to go to one of the community testing locations that's available.